position, which means horizontal recumbent position, is lying face up. The dorsal recumbent position is supine with the knee bent but face up. The Sims position, lying on the left side with the right knee drawn up, and the knee chest position, lying face down with the knee and chest on the table, and lysotomy position, which means supine with the knee flexed and the feet is on the stirrup. I'd like to tell you that the breast is a part of our exam, and so for every single pregnant woman you have to look for the breast. You have to know the size and vascularity, changes in the nipple, changes in the areola, signs of pregnancy, and so on. And so please remember that breast exam is a part of our job. Again, you have to know some signs of pregnancy regarding the pictures of the face, like the presence of what's known as cloisma or mask of pregnancy. Divarication of the recti, which means separation of the recti. The presence of linea nigra and the presence of stria rubra. These are some evidence on abdominal examination which denote distension or intrauterine mass or pregnancy or ovarian cyst or ascites and so on. This is the delucidation which we discussed before. And regarding the obstetric exam, it will include the fundal level. How to do the fundal level? You have to stand on the right side of the patient, and you have to centralize the uterus by your right hand, and then by the ulnar border of the left hand. You have to go down from the xerosternum, going down till the first resistance, which is encountered, which means the fundal level. You can confirm the fundal level by doing percussion in order to know or to differentiate between fundal level and fetal level, because if your hand is not so gentle, you will miss the fundal level and you will go down to feel the fetus, which is wrong. What is the fundal grip? The fundal grip, you have to put your hand flat over the upper uterine segment in order to feel what part of the fetus occupying the upper uterine segment. In 97% of the cases, that will be occupied by the breech, and so you have to know the difference between breech and head. It's very important to remember that while you are palpating or doing the fundal level, the movement has to be at the level of the metacarbophalangeal, and you have to feel the fetal part by your finger and not by the palm of the hand. And so, fundal grip, how to do? Put your hand flat on both sides of the upper uterine segment, start to feel by your finger, and the movement is at the level of the metacarbophalangeal joint. And don't move your hand, but move your finger. When you feel something, ask yourself whether it is a head or it is a breech. What is the significance of the grip? To know whether the upper uterine segment occupying by fetal part or not. If the upper uterine segment is felt empty, this means that transverse line. The umbilical grip, you can feel the umbilical grip by putting one hand on the right side and then start to move the left hand in the form of a sleep from up and down, starting near to the midline and then a little bit away from the midline as a few. No, you have not to calculate it in centimeters or in inch, but you have to calculate regarding the mid-clavicular line. If you feel the back on the mid-clavicular line, this means that the back is lateral. If you feel away from the mid-clavicular line, it will be posterior, and if you feel it inside that line, it will be anterior. And so we have not to calculate regarding finger breadths of your finger breadths or finger breadths of the patient or centimeters or inch, but you have to be defined to a landmark which is a mid-clavicular line. If the back on the mid-clavicular line, it will be lateral. If it is inside, it will be anterior. If it is behind it, it will be posterior. Again, this is how to do the umbilical grip. What is the value of umbilical grip? In order to know whether the back directed anterior or posterior, to the left or to the right of the mother. The first pelvic grip, you have to be on the right side of the patient. You have to sit down on the bed, and then your forearm has to be parallel to the the bed. Put your hand flat over the symphysis pubis. Please remember that your little finger is a part of your hand, and start to catch something. If you catch something, you have to ask yourself, what is this? If the head, the most differentiating point between the head and the buttock is ballotment. Why? Because the tenderness, the small part, and not changing under the examining finger, this could be felt in a frank breach. Again, the most differentiating point between the head and the buttock is the process of ballotment. By head ballotment, we mean that movement of a part independent to the other. And so, if you catch the head and you start to move it, you have to put your left hand on the back of the fetus. When you move the head, the back of the fetus will not move. This indicates that this is a head, and this is known as head ballotment, which is markedly differentiated between internal ballotment and external ballotment. It's very important again to know what's meant by head ballotment. Head ballotment means movement of a part independent to the other, and so if you move the head, the back will not move. But if it is buttock and you move the buttock, the back will move. The second pelvic grab, in order to know the degree of flexion of the fetal head, as you can see, if the head is fully flexed, the occiput will be fixed lower down than the synspot, but if the head is fully extended, the reverse will occur, and so it will be face presentation. As you can see, we do right now the umbilical grip. Put your hand flat over the upper uterine segment. The movement is at the level of the metacarpophalangeal joint. You have to feel by your finger, not by your hand, and you have to know whether something occupying the upper uterine segment or no. If a part occupying the upper uterine segment, you have to ask yourself whether it's the buttock or if the head, and then you have to know the difference between the head and the buttock. Here we do the umbilical grip. Put your hand on the right side, start to feel by the left, in order to feel smooth convexity. The smooth convexity, which means the back, and you have to correlate to the mid-clavicular line. If you feel the back at the mid-clavicular line, it will be on the transverse, like left occipital transverse. But if you feel it inside that line, it will be anterior, and if you feel it outside that line, it will be posterior. Here we do the first pelvic grip, and you have to catch the lower uterine segment, and your left hand has to be on the back of the fetus, and you have to ask yourself whether there is a ballotment or no. You catch the lower uterine segment, you feel something in it, you have to ask yourself whether it is a head, small, regular, not changing under the examining finger, tender. All of these are not of value. The most important point to differentiate between the head and the buttock, when you put your left hand on the back and you have to move the head. Again, in order to move the head at that point, you have to do your movement at the level of the wrist, and not to move your forearm, but you have to move only your wrist and not the forearm. If the head moves without transmission of this movement to the back you can feel it by the left hand, this means that this is the head. It's very important to know we have other two types of ballotment instead of head ballotment. The external ballotment, which means if you push the fetus by the right hand or the right hand, you will perceive it on the left, and then it will come again to the right. And this external ballotment, they usually occur between 20 to 24 weeks of gestation. And we have internal ballotment. If you put your finger inside the vagina and then you push the fetus from below, it will go up and then come again to the fingers in the vagina, and this is known as internal ballotment. There is a marked difference again between external ballotment, internal ballotment, and head ballotment. Head ballotment means movement of a part independent to the other. Why? Because the presence of atlanto-occipital joint, which is not transmitting that movement to the back. Again, we do here the static grips. The first one we do fundal grip, and here we do the umbilical grip, and here the first pelvic and the second pelvic